Kaiser Permanente in the Mid-Atlantic. I want to thank everyone today for coming to the Kaiser Permanente Capitol Hill Medical Center and the Center for Total Health. I also want to personally thank everyone who has stepped up to get the vaccine. In getting the vaccine, you're not only preventing COVID in yourself, you're also preventing COVID in your family members, in the community, and helping to end this pandemic. So I really want to thank everyone who stepped up to get the vaccine and is willing to share their story in particular. We're thrilled to be working with Mayor Muriel Bowser and the District of Columbia. We're incredibly proud to be vaccinating frontline workers in DC and the community. We're also proud that at Kaiser Permanente, we've vaccinated over 5,000 DC residents and frontline workers in just a few weeks. And we're also committed to increase the number as quickly as vaccine supply will allow. As someone who has suffered from COVID-19 in the past year and gotten a vaccine, I can tell you that it's nothing to mess with, and I want to encourage everyone, in particular healthcare workers, to get the vaccine, whether you've had COVID-19 or not. I also want to celebrate the place that we're standing today. This is the Capitol Hill Medical Center. It's one of the first multi-specialty hubs in the region for Kaiser Permanente that offers us incredible functionality to take care of the residents of DC. And this is the 10-year anniversary of Kaiser Permanente Capitol Hill Medical Center. As one of the largest and busiest medical centers in the region, we're proud to deliver high-quality care, and particularly over the past year, we're incredibly proud of the work that our doctors and our staff have done to pivot to provide excellent care for COVID patients, vaccinations, along with world-leading preventative health care, surgical care, medical specialty care, and primary care. I'd like to introduce Dr. Sheetal Desai, who is our physician-in-chief in Washington, D.C. and suburban Maryland. Welcome, Dr. Desai.
Thanks so much, Dr. McCarthy. So as Dr. McCarthy mentioned, we knew when the pandemic began a year ago across the health community that a vaccine would be vital to ending this pandemic so that we can all return to our normal lives as quickly as possible. Over the past few weeks, we've had the honor of vaccinating some of our frontline workers and highest risk patients as they have taken the vaccine here at Capitol Hill Medical Center. Yet there are some who are fearful and hesitant to take the vaccine. As a physician and a member of our community here, I want to share that I believe the vaccine is safe and that everybody should get it when given the opportunity. The COVID-19 vaccines were developed in record time, but I assure you that science was not skipped. In fact, we must recognize that some of the most advanced vaccine technology, which was in development for 2 decades, was used to safely develop and deliver these vaccines. These vaccines provide a bright light at the end of a long, dark tunnel, and they have been proven to be safe and effective through 3 phases of clinical trials involving tens of thousands of people. Those of us in healthcare and science want to address the myths and the misconceptions with this vaccine and help everyone in our community feel safe and confident in getting this critical shot. I got my shot. I actually got my second shot here yesterday at the Capitol Hill Medical Center. And when it is your turn to get your vaccine, please step up. Take it for your own health, your family's health, your coworkers, and your community. Lastly, we must remember that despite the vaccination, we must all still wear masks. We need to continue to wash our hands, and we need to continue to physically distance and avoid crowds. Until we can get most of our community vaccinated, we need the combination of the vaccine and important public health steps to control the virus and keep each other healthy. Mayor Bowser, we're truly honored to welcome you back to Capitol Hill Medical Center today to receive your COVID-19 vaccine. You are taking this important step and demonstrating to everyone in our community how we can tackle this virus and put an end to the pandemic. We're proud to welcome you to the podium.
Thank you, doctors, for that introduction, and thank you for everything that you're doing here with us, with DC government, our first responders here at Kaiser Permanente Capitol Hill. And this is the second time that you've hosted us in about a month, and I want to thank you for that. We were here a month ago vaccinating our DC Fire and EMS team, and I know that Chief Conti and the MPD command staff were also here on Friday for their vaccinations. I was here a couple of weeks ago again with my parents for their vaccinations. And also this week, we will begin public school teachers through a partnership with Children's Hospital. At sites across DC, we continue to get our senior residents vaccinated as well as our healthcare workers. And today, as Dr. Desai mentioned, as part of our continuity of government operations plan, I will get vaccinated here at Kaiser. And you just heard from the doctors how important these vaccinations are. We release data every day about our community's experience with COVID. And while we continue to be grateful for sacrifices of Washingtonians to stop the spread of the virus, we know that there's still work to do to turn all of the metrics that we report every day green. And getting our community vaccinated is an important part of that process. I was proud last week that with the help of partners like Kaiser, the CDC put Washington, D.C. at the top of their list for states administering the COVID vaccine. Let me say that another way. They put us at the top for our efficiency in delivering the COVID vaccine. Already, we have been able to administer more than 51,000 doses of the vaccine. And as Dr. Nesbitt explained last week, these numbers tell part of the story, and it's a good story. But these numbers are also constantly changing as we get shipments of the vaccine in, schedule appointments, and our healthcare professionals deliver the shots of the vaccines. And it is truly a citywide effort. There are a lot of moving parts and a lot of priorities to be advanced. These numbers show the breakdown of where doses are going this week. And we also provide an update to last week's. They demonstrate just how much our medical providers are working together and working with DC Health to get the vaccine to prioritize populations. As you know, this week DC is receiving 8,700 doses of the Pfizer vaccine and 5,600 doses of the Moderna vaccine. Get this so I can actually see it. And we also break down how all of those appointments are distributed per vaccine. Further, we also know that several of our hospitals and medical providers in the district, such as the one that we're in right now, have a limited supply of the vaccine that they are also providing to their eligible patients, which in this example include our first responders, people over the age of 65, and healthcare workers. You can learn more about each provider at vaccinate.dc.gov. So before I wrap up, I just want to encourage everyone in our community to reach out to the people in their life who are 65 and older and make sure that they are know that they are eligible to get the vaccine. And this is an important point. I've heard so many people talking about helping their parents call or get online or reminding them of what we have discussed in this press conference or seen in other places. So for people like me with senior parents who do very well with technology and the phone and all of that good stuff, still a gentle reminder has been very helpful for them. So please check in with your friends and family. Think about your neighbors, seniors from your church, or grandparents, their friends, and see if they need any assistance in making an appointment or getting to where they need to be to get their vaccine. I'll also end, and it was more important hearing it from Dr. Desai, but I want to add my 2 cents as well. We know, from what we know, scientists have been researching how to make this vaccine for years, and this vaccine is safe. Most of us didn't talk about coronavirus before 2020, but doctors and scientists did, and they have been working for years to develop this vaccine. You heard Dr. Nesbitt say last week that many people said they're waiting to see, and still we should remind them that 10 million people have already taken the vaccine. So if you were nervous about being first, 10 million people have been ahead of you. It's also effective. We know that the vaccine works, and for now, until enough people get vaccinated, we will continue to need to wear our mask. Eventually, this vaccine is the key to ending the pandemic and getting our lives back. So please go to vaccinate.dc.gov, where we have a lot of information about the vaccines, and you can learn when it's going to be your turn so you can get ready. All right, with that, we'll take a few questions. Any questions? Yes, Mark.
Can you tell us what phase we're in right now, and give us any indication of a timeline of when we're going to get to the next phases?
Yes, I'm going to ask Dr. Nesbitt to describe that.
Sure, Mark. We are still in phase 2, and as has been our posture, we do not provide timelines as to when we will be able to move into any different phase, whether it will be a phase that is higher or lower than our current phase. And the reason for doing that is because we have to be able to observe trends that will indicate if we're going to be able to be less restrictive or more restrictive than our current posture.
Okay, so if I could just clarify, when you say phase 2, do you mean 1B, tier 2?
You mean vaccinations. I
Yes,
thought you
ma'am.
were talking about as it relates to our non-pharmaceutical interventions. We are in phase 1B, tier 2.
Okay. And so in phase 1B, tier 2, we see grocery store clerks and child care workers included in your list, but are they now eligible or are they not eligible?
Fantastic. I appreciate the opportunity to respond to this question. You may recall 2 weeks ago when we introduced the phases and tiers concept, we were very mindful, and the mayor was very clear about this, because a couple weeks prior to that, because of requests to provide tentative dates, we did that. We were reluctant to provide tentative dates because we were also very clear that our ability to adhere to any dates that were given as tentative was based on the amount of vaccine that we received from the federal government and demand and uptake from vaccine from previous tiers. You all are well aware, and I want every DC resident to hear me loud and clear, and I'd appreciate an amplification of this message, is that we simply do not have enough vaccine. So even with our best plans and us rolling out the phases and the tiers 2 weeks ago, we are still in a position where we cannot implement fully any tier of a specific phase. So our goal of creating tiers within our phases was that we would be able to fully implement a tier of a phase, but we can't even manage to do that with the dismal amount of vaccines that we are receiving. So we're in a position where I still have to make a decision based on risk, based on logistics, and based on other factors that we have to break up tiers within a phase. So while we are in phase 1B, tier 2, all of the groups within that phase do not become eligible at the same time.
So how do people know, other than obviously watching these press conferences, but when they look online and they just see, you know, the list and the phases broke out in the presentations, they would look at that and they might assume that, oh, I could go on and register now because we're in tier.
Sure.
Tier.
Excellent question. Excellent question. So we do this through two things. At the time that someone goes to register, either through vaccinate.dc.gov or through the call center, we make clear who is eligible at the time of registering, and it makes an included specificity. So, for example, all teachers are not eligible. We are focusing on those who provide in-person services. And even within our tiers, we define essential personnel as having to report in duty or be in person. The other thing that occurs is that your employer may be providing you instruction as to how to access vaccine through a closed pod structure. So, for example, the DCPS infrastructure is a closed pod. So they are not this week accessing vaccines through our community sites. So those are ways that people find out if their eligibility is in fact activated for that week. So it's a great opportunity for us to sensitize people to what the process is like. It's no different than the state of Maryland announcing that a phase has moved forward, but the counties in Maryland who actually implement the phases may be doing something different than what the state announces.
And just my last question on this line, and I appreciate
Sure.
your patience with me.
No problem.
So I no longer see continuity of government in the list, but I see essential government workers, but they are not until 1C Tier 1, which is 2 tiers away.
Sure.
So I'm just wondering how you guys are qualifying under continuity of government if essential government workers are not until 2 tiers from now.
Sure. So there's a difference between essential government workers and continuity of operations for succession planning. So we have been able to focus on our succession plan for government separate from our continuity of government operations, which would be the thousands of staff who help to operate government agencies. Those remain in the tiers as you have referenced them. You're welcome.
And let me just add that a lot of DC government workers have already been vaccinated, and fire and EMS, Metropolitan Police begin today, and DC public school teachers will also begin this week. Yes, ma'am.
A couple questions on the vaccine. So as it is now, seniors have to check weekly, right, to book a vaccination appointment. So I'm wondering, and this process can be anxiety-inducing. So I wonder why isn't there a wait list, as I understand other city governments have done?
Well, you can have anxiety from 1 week, or you can have anxiety waiting for months with a wait list or a date. So we are carefully considering all of our options.
So you are weighing whether to have a wait list for seniors. So I mean, I guess it's also the process of having to go every day, to be very online, there's a call center, but the process in and of itself can be anxiety-inducing is what I mean. So are you weighing to have a wait list of some sort?
I don't know how, I wouldn't say that we're waiting to have a wait list, but we want to make sure that we have the best processes in place, and so we'll continue to consider that.
Sure. And then another question. Do we know how many of our 85,000 healthcare workers have been vaccinated? Do we know this to be a majority?
I'll ask Dr. Nesbitt.
Sure. We're working with the various employer groups to more accurately assess that data element. Initially, as we launched the program, we focused on closed pods with our health systems, and they have some data that we are working to verify and to clean. The other challenge is that a lot of those healthcare workers do not work in health systems. They work in smaller organizations. Some of them were vaccinated within DC through our community settings. Others were vaccinated in their home jurisdiction as their state or their local health departments opened up mass vaccination clinics or community clinics that were operated at the local health department level. So it's a little bit different for us to be able to accurately estimate that number. It could be both an over or an underestimate. But we can do an estimate of the percentage, for example, at MedStar Washington Hospital Center who were vaccinated, or at Fire and EMS who were vaccinated. Once you get into home health aides who do not work within a health system, it gets to be a little bit more challenging.
And then one final question. Why was it important for you to get vaccinated on camera today? I just was hoping you can talk to me about why it's important to have leaders of the city to get vaccinated in front of people, and just talk to me about why. Yeah.
Well, thank you for that question, because I hate needles, I got to tell you. So it is, you talk about anxiety producing, getting vaccinated on camera is, it's causing me some anxiety. But having said that, I always get my vaccines. I get my blood drawn when my doctor says I'm supposed to, even though I don't particularly like needles. But it is important for all of us to get the vaccine when it's our turn so that we can get our lives back to normal. And people rightly have questions and concerns. And I hear those questions just in my social circle and circle of family and friends who are asking questions, educating themselves so that they're prepared when it's their turn. And so I want to let everybody know I've done all of that important question asking and getting the answers that I need, and now I'm getting vaccinated.
Sorry, another follow-up is how many, who else in your staff in the executive office has gotten vaccinated?
We will have, as part of this group, it will be our Emergency Operations Center. So that's a group of about 50. And there are others that fall into other categories, healthcare professionals, people who meet the yes. Yes.
Speaking of vaccine confidence, do you have a sense of how many school support staff and teachers feel confident the vaccine will actually be taking the vaccine if offered? I know some other districts have, surveyed their teachers to see. I'm curious if you know how they're feeling.
I am very pleased with the take-up thus far, and Dr. Nesbitt, I think, has the numbers on the top of her head.
Sure. I don't have with me what the complete for all of them, the non-in-person and in-person, but for the number of vaccine appointments that were released over the weekend, about 70% of those have been claimed already.
Do you know if support staff and teachers are taking you up on those appointments at the same rate?
I don't have the breakdown for this morning in terms of what proportion were taken up by teachers versus support staff.
Okay.
Just an anecdote. I was in a school on Friday. I think that's the day, or whatever. It was Friday, the date that the appointments were released. I stopped in the front office who were all support staff. 3 people in the room had already gotten their email and had already signed up. So that's just one small anecdote out of our whole system.
But actually, that 70%, is that charter schools and DCPS,
No,
or
that's
just the DCPS?
We don't have the charter information yet. Yes.
Say declined? I wasn't clear on. I couldn't. 70% of them declined.
No, have accepted or scheduled.
And what's the number there?
Of the 3,900 appointments that were released, 70% of them have been booked.
3,900 were released appointments. 70% have been booked.
All DCPS.
Those are DC public schools, yes.
What about charters? Is there any?
Charter schools are, they will make their appointments this week.
So, Mayor, how is it working with the ward system? I know, for example, I've heard some of the people said that the appointments are taken up in Ward 3, for example, or that a number of the people that went to the clinics in Ward 7 were not really from Ward 7 and there was some limit. What's the work? How does that work?
You can go any place where you get an appointment. If your question is how are priority zip codes working, I think DC Health has made every attempt to align our experience with COVID with how we're making the COVID vaccine available.
So, for example, if you're from, say, Ward 3 and they're all taken up there, you can go to a different ward?
When you go to schedule an appointment, you can schedule your appointment anywhere in the city.
Okay, and are they limiting, for example, the number of people are they, let's say...
You may remember that on Thursdays, we make the appointments that are now available for seniors and healthcare workers available on Thursday to priority zip codes, and on Friday we release an additional number of appointments that are available citywide.
Okay, so because I'd heard some complaints that people, say in Ward 7, couldn't get in, but then the people that were in line were from other wards. Are you preserving some for particular zip codes?
As I mentioned, there is on Thursday, There are priority zip codes that include every ward, except they include 5 out of the 8 wards that are released on Thursday, and these are for zip codes that have higher experience with COVID infection and fatality. So in those priority zip codes, a certain amount of appointments is made available. The following day, another allotment of appointments is made available. And the reason I can't give you the specific numbers is because those numbers change from week to week. Yes, sir.
With the onset of bad weather, and we know how we react to bad weather, that might impact people showing up for their appointments on a day that they're scheduled to go get their appointment, but because of weather would not be able to get there. So what is the protocol then if somebody misses an appointment through no fault of their own as far as rescheduling? And also, what happens to those doses that you may take out of refrigeration in advance of these people showing up when they don't show up?
Well, we're hopeful that the weather won't be as bad as you seem to think. And it is improving. The forecast has improved for Thursday. So,
I mean, before the end of the winter, we're going to have bad weather.
Let me ask Dr. Nesbitt.
Sure, and this question goes to the heart of why we have a small network of providers who are able to manage the storage and handling requirements and the logistics of vaccines in order to account for individuals who may miss appointments because of inclement weather or other life circumstances that may come into play, and their ability to access other individuals who may be available to be vaccinated. I'll give you an example. Last week, I was in a Safeway where our instruction to all of our providers who have signed a provider agreement to us is to not waste a dose. You all may recall that very early in the launch of our community-based program, there was lots of milling around and rumors around that you could just show up at a grocery store and get an extra dose of vaccine. Well, that doesn't happen now because the number of people who are showing up for their appointments is near 100%. If not 100% at most locations. So the likelihood that happens is markedly decreased. Now, in the event that there is inclement weather, what all of those facilities have done, and speaking to one of the cashiers in the Safeway, is that the amount of outreach to those grocery store workers to be ready to be vaccinated if someone does not show has increased substantially since the launch of that program. So many people who should have been eligible for those vaccines, as opposed to community members who were coming in who would be members of 1C or probably phase 2, are going to not be getting the vaccine. They'll be getting it to those essential workers who should be eligible. So that's what will happen. The other part is that these providers have pharmacists who do a really good job of knowing when to remove the vaccine from the freezer, when to begin the thawing process, when to draw up the vaccine. And if you observe the process here, when the clinical operations were much busier, the day that I got vaccinated, there were a lot of people who do this very timed process of drawing up the 6 doses, 5 doses, or 6 doses if they can get one, to make sure that you don't have something in a syringe that may be wasted. So the logistics of the process, the pharmacists who are involved in ensuring that there is no dose wasted, the clinicians, the nurses, like I thought I saw Corey in here earlier today, who make sure that they are communicating whether the patient has actually checked in, is here, is on site, and how many doses they already have drawn up, ensures that we are limiting the amount of wasted doses that we have in the District of Columbia.
Okay, we'll take a few more. Carrie?
Yeah, they had a question about National Guard. My understanding is that initially you had said, or the district had said, that you would have 500 National Guards on standby. I'm now seeing reports that 5,000 will be here on call because of the impeachment trials through mid-March. Can you confirm that and explain who called these additional National Guard troops?
I can tell you what our request was, and I'm going to ask Director Rodriguez to talk about the federal request.
Yeah, Perry. So our request, the request from the Metropolitan Police Department, was for 500 Guard personnel. And that request has been approved. Now, the other requests for the Capitol or for the White House, we'd have to, direct those questions to those relevant federal authorities. But we have seen reports of 5,000 at the Capitol and 500 at the White House.
So those requests did not come from you for additional troops, and you don't know, you're only reading the reports too?
That is correct. MPD requested 500. The thousands were from federal requests.
Can you confirm that, or is that just from reports that you're speaking of?
Well, we're in ongoing dialogue with the National Guard and with the leadership of the National Guard and the new acting Secretary of the Army. So I think some of those numbers are still in flux as those requests are being worked out at the Department of Defense.
Do you think those additional troops are necessary in the city?
Well, I'm not going to comment on that, but I would say I would direct those questions to the federal authorities who are requesting those assets.
Okay. One?
I know, Dr. Nesbitt, you're asked near weekly when we're going to see race and wastage data for the vaccine. I just wanted to know if there were any other updates on that. Sure.
It's a great question. As I mentioned earlier with Mark, is that we're trying to clean up the data in a much better way. I can give you, for example, when I was reviewing the race and ethnicity data, we have about 56% of the data that is being reported as other and unknown, which is not reflective at all as what we typically see with our data in the district. 28% as white and 15% as black with vaccine data. And it's just not a complete data set. So many of the fields are missing, or they're being filled in a way that's not reflective and reliable data. So it's not of a quality where we can report it and it be interpreted as anything meaningful. So what we're doing is we're working with the vaccine providers who don't typically have electronic health records to when individuals come in for the second dose to do a much better job of accurately completing that field. The second issue around wasted doses is that there are disparate systems in which that data is reported, and we need to be able to have that data at the local level in a way that we can report it out reliably to you all.
Okay, last two, Terry and Mark.
Related questions. Right now, we have 52. The last numbers I have heard are 5,200 kids have accepted slots. That's about at a third capacity. I know you guys expect it to grow a little more. But what is your take of that acceptance, and how are you sure that this plan is hitting the kids who need it the most?
Well, it's hitting the families who want it. So our job, Perry, is to make sure that we have prepared our system for in-person learning, and that's exactly what we have done. We have made incredible investments in our buildings, in making and ensuring that we can have physical distancing. We've improved our ventilation systems building-wide and in every classroom. We have all of the PPE that we need. We have a testing regime for staff and for students, and we have an agreement with our teachers union. So we have done everything possible to get ready. More than that, Dr. Farabee and DCPS have made those options available in the way that parents and school staff said they wanted. They said they didn't want a one-size-fits-all program, and so that every school leader could work with their community and their teaching staff to put out a program that works for that individual school community, and that's what we've presented. So I feel very good that we've done everything that we can to give our kids what they need, and what we know is that kids have suffered over the last year. All right. So anybody who wants to dispute that? Kids have suffered. All right. And we know that quality teachers in quality school buildings is the best chance that we had of providing high quality education. So we've done everything that we can to make those opportunities available for kids and families in a pandemic. And I feel very, very good about that.
I've talked to a lot of charter leaders who have been looking specifically to DCPS to open before they make that step. I mean, right now, infection rates, we know their caseloads are higher in this city than they have been in the past. What would you say to charter leaders right now who are deciding whether they should be opening right now?
They need to get open too. And in fact, I'll say something more formally about that. As they're, for most people realize, about half of our kids are in DCPS, about half are in our public charter schools, but they're all DC kids. And they need to get open too. We have more other kids who are in private schools, and quite frankly, many of those kids have been in school throughout the pandemic. So we need our buildings to get open. If we haven't already today, expect that the public charter school leaders should expect that we have a building fund that we will make available to them so that they can also continue to make the investments in their buildings that they need to make. We've also made the testing and vaccination programs that are available at DCPS available to them. Yes.
Just one last vax and one off topic, if I could. On the vaccine, are you considering, or do you have the authority to require either students, government employees, or anyone to take the vaccine as a requirement? Is that something you've looked into?
Well, as you know, the vaccine is only approved as an emergency use for people over 16 years old. So let's just put the kids to the side. And we, at this stage of approval, we don't anticipate making it mandatory, nor could we until there's a formal approval.
And then off topic, we saw 5 people were shot, at least one person dead this morning on Good Hope Road. This comes after a violent few days of homicides in the district.
Yep.
Just your reaction to the level of violence that we continue to see.
I haven't been fully briefed yet. The chief called me before I came in today. He is going to let me know exactly what happened. But generally, Mark, we still have had a level of violence to start this year that is jolting to all of us, and we'll talk to the chief about more. What we don't think is that they're connected in any way, but connected to the prevalence of guns in our city. All right, thank you. This is showtime for me. Thank you.
We invite you to have a seat, Mayor Bowser. And it's my honor to introduce Rashay Caselli, an advanced urgent care nurse with Kaiser Permanente, who will be administering the vaccine today to Mayor Bowser. During the pandemic, Rashay has provided hundreds of COVID-19 tests to Kaiser Permanente members in our outdoor testing unit, and we're thrilled that she's now using her years of experience as a flu vaccinator to provide COVID-19 vaccines to our DC residents. Thank you, Rashay.
Thank you. Good morning, Mayor Bowser. How are you? Okay. All right. I heard you're a little nervous. Don't be. So I am going to ask you a couple of questions before we get started, okay? In the last 2 weeks, have you had any other vaccine?
I haven't.
Okay. Have you ever had a severe reaction to a vaccine in the past?
I haven't.
Okay. So for the next 6 weeks, we would ask that you not get any other vaccine aside from your second dose of the Pfizer vaccine. Okay? We've already got your second dose scheduled.
Thank you.
And once we're finished, I will direct you to where we will have you wait for 15 minutes, okay? So we're doing your left arm, correct?
Correct.
Okay. That is it.
Is that it? Yes.
You are vaccinated.
Thank you.
You're welcome.
Okay. That wasn't bad at all.
No, I told you. You're welcome. So if you just exit out the door over here, someone will meet you for your 15 minutes.
All right, you got it.
Thank you. Thank you, Mayor Bowser.
You're welcome.
Thank you all for joining us today at the Kaiser Permanente Capitol Hill Medical Center. This concludes our event for the morning. Thank you.
Thank you.